As the mental health crisis continues to surge in the U.S., it's more important than ever to raise awareness about the impact clinical depression, also known as major depressive disorder, MDD, can have on someone's life. So here to discuss the signs and symptoms of challenging to treat depression and an available treatment option are board-certified psychiatrist and chief medical officer for HopeMark Health in Illinois, Dr. Abed Nazir, and also Karen, one of his patients. Guys, thank you so much for joining us today.
Of course.
Thank you.
Thank you.
Now, Dr. Nazir, can you tell us about the signs and symptoms of clinical depression and how common is it?
Yeah, so clinical depression, or what we call major depressive disorder, is actually super common. It's 1 in 10 adults in the United States have been diagnosed with major depression. And the signs and symptoms, really, it starts with a predominantly sad mood. It can also be an anhedonic mood, meaning you just don't find pleasure in your day-to-day activities. There are a host of other symptoms that come along, such as changes in sleep, appetite, concentration, energy level. It can get more severe, where you actually feel helpless, hopeless feelings and thoughts of not wanting to live. And when all that is occurring together and impacting your ability to function, we call that major depressive disorder.
Dr. Nazir, what is treatment-resistant depression and what are the available treatment options?
Yeah, so if you have major depressive disorder and have tried 2 antidepressant trials and not found relief, that would be considered treatment-resistant depression. It's maybe 1 in 3 patients that have major depression would be considered treatment-resistant. There are a host of medications and other treatments that have been around, but there is actually one medication specifically that is approved for this, and this is why I've partnered with Johnson & Johnson to talk about this medication option. I've seen a lot of success with my patients. It's called Spravato, and it's a nasal spray. It's actually administered in a certified treatment center, and it's approved for individuals that have treatment-resistant depression and are on an oral antidepressant already.
So Karen, this is for you. Can you tell us about your experience with treatment-resistant depression?
Yeah, well, I like to consider myself a very optimistic, positive, and hardworking person that does not like to stay depressed. So when I began feeling these symptoms, it was making it very difficult for me to do my day-to-day activities, such as go to work or do the things that I like to do. And so I started investigating with my doctor, and antidepressants were then prescribed. And they worked for a little bit until they stopped working completely for me. And that was very scary, very frustrating, and I was exhausted from how daring these symptoms are.
Dr. Nazir, how can people help a loved one who has treatment-resistant depression or is even struggling to find the right treatment for them?
Yeah, if you have a loved one that is struggling with depression, especially treatment-resistant depression, the first thing to do is really contact your healthcare practitioner, possibly a psychiatrist or a therapist. And it's important to know that not every medication is right for everyone. Spravato is a monitored treatment. There can be side effects and risks from this medication like any others. It's important to know that there are resources out there, such as like going to Spravato.com if you want to learn more about that treatment option, or if you're in crisis, you need more immediate help. One resource could be texting or calling the Suicide Lifeline, which is texting or calling 988.
Guys, thank you so much for being with us today. We appreciate it.
Thank you.
Thank you.